is there a risk for a female child who gets their vaccine now? Is there a risk for her reproductive health, and specifically about stillbirths?
Yeah, so this is a good question that comes up again and again and again. And I think what I'd mentioned too is that this comes up with every vaccine again and again and again. There's no evidence to support that people who are vaccinated are any more likely to have miscarriage or stillbirth. So there's no evidence that. And actually, we had a lot of people who were vaccinated in pregnancy. And now the vaccines have been around long enough, and in the trials as well, they were vaccinated, have then gotten pregnant, and then had children. And there's no evidence that the vaccine, one way or the other, has any impact on that. COVID is a risk for that, though. So a COVID infection can be very dangerous in pregnancy, including stillbirth, miscarriage. Stillbirth, I assume when it's a stillbirth is not just miscarriage, but later term miscarriage, right? So COVID certainly can be a major risk to both the person who's pregnant. We see a much higher risk of being admitted to ICU. And that's actually because your immune system is in a different place when you're pregnant. It operates differently. So when you get a COVID infection, your immune system really takes it way too far in a pregnant person and kind of goes into overdrive. And that actually can cause a lot of the damage. How we actually treat COVID in someone who's pregnant is delivering the baby, interestingly, because by the person not being pregnant anymore, that can actually be largely what saves their life. So we have to be very careful with that. And so vaccinating children, I think this question is, if I have a daughter, for example, will vaccinating her now increase the likelihood of stillbirth in the future? And it's such a hard, I think this is why we see this come up again and again in the anti-vaccine rhetoric, is that it's such a vague fear that it's so effective to say this to people, and then it becomes a doubt that just sits in the back of their mind. And that's actually how I see it worded in the anti-vaccine literature online is people will say, well, how will you know? Wouldn't you feel terrible if this happened in the future and you had no idea? And I think you have to be very careful watching out for that, because that comes up with almost every single vaccine. It is studied with other vaccines. There's no evidence whatsoever that's the case. And that, one interesting study that was done in rats that I was looking at the other day, they took rats and they gave them human doses of the mRNA vaccine. They gave them 2 doses. Now, if you think in rats, they're tiny and humans are big. This was like 300 times the dose you would normally give a rat if you were based on weight. So they gave them human-sized doses to these small rats. They gave them 2 or placebo, 2 doses of 30 or placebo, and then they impregnated them. There was no difference in the rate of getting pregnant. And then during the rat's pregnancy, they gave 2 more huge, massive doses and it had no impact. And so there's lots of ways that they're looking at this. Another one that they've looked at is, I think I mentioned this, an IVF study, in vitro fertilization, where they had women and people going through in vitro, and who were vaccinated, unvaccinated, they looked at the eggs and they looked at the hormone levels, and they didn't see any differences either. And so, because of this actually gets studied an awful lot, because there are a lot of worries about this. There's no evidence that the vaccines have any impact on fertility, on pregnancy, and if anything, they're recommended for people for in the future when they become pregnant to protect against that severe illness. And that's by the Canadian Fertility and Andrology Society, Society of Obstetrics and Gynecologists, National Advisory Community on Immunization. They all advise that people who are planning pregnancy or who will be pregnant in the future get vaccinated now.